Well, if you don't wear what you want because you're trying to cover up unsightly veins, you don't have to do that anymore. We can solve your problems this morning. Our friends from Vein Tech are in the house. Robert Thompson is here along with William Clark, who is a patient of Dr. Thompson's. It's good to see you guys.
Thanks for being here.
Oh, man. You know, last time you were here, I think we spoke with one of your female patients, which a lot of people are like, yeah, women were dealing with varicose veins, spider veins all the time. A lot of people don't know that guys are dealing with varicose veins as well, even spider veins.
They do. Statistically, 40% of women, but 15% of men will get varicose veins sometime during their lifetime.
And they can be very painful and keep you from doing the things that you love.
The men are usually the worst because they come in later. They wait till they really are painful, and then they finally give up and come in.
So, William, what brought you into Vein Tech? Tell me what your situation was.
Actually, a family trip brought me in.
Really?
Yes. Actually, I was real conscientious about it. I didn't want the long shorts. I didn't want to wear the short shorts or anything like that because I didn't want to show the vein off. It was pretty bad. Yeah. So that's what brought me in.
Okay. So, you know, it's important to realize that this isn't something that just the ladies deal with. And were you uncomfortable going in? Did that keep you out for a while?
Yeah, a little bit. It did. You know, but in the long run, the benefits from it is what I really enjoy.
Okay, so let's talk a little bit about Vein Tech and what you guys treat, and we'll start with sort of, I guess, the baby veins, the spider veins, because a lot of people are dealing with those. We've got a picture of spider veins just to kind of show you what they look like. These are the smaller versions, right? And they're a little bit easier to treat.
Yeah, these are just small capillaries in the skin. They really aren't a health issue, but they are an appearance issue, and these can be treated just with an injection of a chemical that makes these veins shrivel up. Okay,
so that's really simple. Let's take a look at the next before and after picture, and we'll see what we've got going on here. This is a serious varicose vein.
These are the type of veins that Bill had. These are large varicose veins, and these can lead to bleeding, phlebitis, a lot of skin issues, and can be quite painful. Okay, and then the final picture we have, I think, is actually what Bill was dealing with, right? Similar. These veins can go all the way from the groin all the way down to the ankle, and they can be in both legs or one leg. They can be quite extensive. Okay, so how long did you put up with those, William?
Probably about 3 or 4 years.
Really?
Probably about 3 or 4 years, yeah.
And were yours painful, or just you didn't like them so much?
They weren't painful.
Okay.
Mine weren't painful. It's just the appearance is what got me.
I've talked to guys who were in a similar situation like yourself, and they didn't want to golf. Because they want to put the shorts on, but at the same time they were painful for them as well, and they can be painful. So how do you treat something like that?
These large veins are usually a two-stage treatment. There's a main branch that comes down the inside of the leg that has to be treated with a laser. Okay. We weld the vein shut until it doesn't supply those branches with any more blood. And then the branches will shrink down to the point that we can just remove them with little tiny needle sticks. Okay. So cosmetically, it's just a needle stick and a couple of procedures. Okay, so let's talk about your situation. Guys usually have a pretty good pain tolerance. Did it hurt at all?
I don't like shots. So when the needles come out, the nurses tend to laugh at me.
Yeah,
so,
yeah.
He was pretty brave, though.
For the most part, you know, of course, the shots were a little painful, but, you know, it was the numbing agent that he gave me and stuff. And once I got that, you know, he did a lot in one day on me. Okay. And the surgery itself, the procedure itself, wasn't painful. Okay. Afterwards, I had a little bit of bruising, but it went away quickly. Yeah.
And I want to point out that this technique that you do today is nothing like the technique that they used in the old days. A lot of people still think it's still that stripping, and that's scary. It's not like that anymore. No,
that's what prevents most people from coming in, is they've always heard their parents or grandparents had vein stripping, which required hospitalization, lots of incisions. This is very cosmetically much better. It's a quick recovery. You go back to work the same day or the next day, and a lot less pain.
And how are you feeling now?
Good.
Looking good?
Good.
They call you hot legs on the golf course?
No, I wouldn't go that far.
Well, I want to let everybody know about our special offer this morning, because there is a holiday promotion for you to take advantage of. It's great to do something like this in the winter months, because then you can show off your legs all spring and summer long. So here's the deal. We've got 20% off all spider vein sessions, and that will go on now through December 31st at all Vein Tech locations. So take advantage of that. Get it done now. Find out more online, veintech.com, or call the number on your screen and ask them about the San Antonio Living Show. It's 483-8822. And I want to let you know where the Vein Tech Varicose Vein clinics are. There are 2 here in San Antonio, one in the Medical Center, the other in Stone Oak. And again, you can find them online, veintech.com, or by calling this number, 483-8822, for for more information.